conférence est enregistrée.
Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's update on COVID-19 in Canada. Bienvenue à la mise à jour au sujet de la COVID-19 au Canada. Today, we'll hear remarks from Canada's Chief and Deputy Chief Public Health Officers, Dr. Theresa Tam and Howard New. The doctors will be available for questions afterwards. Aujourd'hui, nous entendrons des allocutions de la Dr. Theresa Tam, administratrice en chef de la santé publique, et du Dr. Howard New, sous-administrateur en chef de la santé publique du Canada. Les docteurs seront disponibles pour des questions des médias après leurs allocutions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Let's begin. Over to you, Dr. Tam.
Merci. Thank you, and bonjour à toutes et à tous.
Thank you. Hello,
Last
everyone.
Friday, we presented an update on the epidemiology and modeling in Canada, showing that efforts to increase vaccine coverage and reintroduce public health measures in heavily impacted areas have been effective in slowing spread at the national level. Encouragingly, the updated modeling forecast suggested that we could observe a decline in daily cases in the coming weeks, so long as we continue to increase vaccine uptake as well as maintain existing public health measures. While we are cautiously optimistic about the trajectory, the latest modeling also underscored the need to remain vigilant to protect our progress and reduce the risk of overwhelming healthcare capacity, especially as we head into the respiratory infections season. The latest surveillance data from this week indicates that although the virus continues to surge and present ongoing challenges in several areas of the country, overall, we're observing a decline in COVID-19 disease activity nationally. Over the past week, there were an average of over 3,160 new cases being reported daily across Canada, a decrease of 15% compared to the week prior. However, severe outcome trends remain elevated, with an average of more than 2,500 people with COVID-19 being treated in our hospitals each day, including over 750 in intensive care units, and an average of 40 deaths were reported daily. COVID-19 cases and hospitalizations are predominantly occurring among unvaccinated people. From end of August to late September, the average weekly rate of new COVID-19 cases was 8 times higher, while the average weekly rate of hospitalizations was 26 times higher in unvaccinated people than in fully vaccinated people. With Thanksgiving behind us, this means we're also entering influenza or flu season. The virtually non-existent last year, thanks in large part to the public health measures in place to reduce the spread of COVID-19, but it has not disappeared. This year, anticipating a possible flu resurgence due to lower levels of immunity in the population as a result of less circulation last flu season and easing of some restrictive community-based public health measures made possible thanks to the high COVID-19 vaccine coverage. The behaviors we have learned during the COVID-19 pandemic can help keep us and our communities healthier this fall and winter. This includes getting the flu shot when it is available to you and consistently maintaining individual protective public health measures like wearing a mask, improving indoor ventilation, washing your hands often, and staying home when you're sick. Individual public health measures are the foundation of good public health practice and help prevent the spread of flu, COVID-19, and other respiratory illnesses. Getting a flu shot is more important now than ever. It helps prevent the flu and related complications such as pneumonia, and can also help reduce the severity of symptoms. If a continuing fourth wave of COVID-19 were combined with a resurgence of the flu, this could place additional pressures on the healthcare system. By following public health practices to reduce the risk of COVID-19 and making sure all our important vaccinations are up to date, we are doing our best to protect ourselves and others. Thank you. Merci, Megwich.
Bonjour à toutes et à tous.
Vendredi dernier, nous avons présenté une mise à jour de l'épidémiologie et de la modélisation de la COVID-19 au Canada. Il en ressort que les efforts déployés pour augmenter la couverture vaccinale et rétablir certaines mesures de santé publique dans les régions fortement touchées ont permis de ralentir la propagation de la maladie à l'échelle nationale. Les nouvelles prévisions modélisées sont encourageantes et suggèrent que nous pourrions observer une diminution du nombre de cas quotidiens dans les semaines à venir si nous continuons à augmenter la couverture vaccinale et si nous maintenons les mesures de santé publique existantes. Malgré un optimisme prudent quant à la trajectoire, la dernière modélisation a également mis en évidence la nécessité de rester vigilant pour préserver nos acquis et réduire le risque de dépasser les capacités de soins, en particulier à l'approche de la saison des infections respiratoires. Selon les dernières données de surveillance de cette semaine, nous observons une diminution de l'activité de la COVID-19 à l'échelle nationale, même si le virus continue de progresser et de poser des problèmes dans plusieurs régions du pays. Au cours de la dernière semaine, plus de 3160 nouveaux cas ont été signalés en moyenne chaque jour au Canada, soit une diminution de 15% par rapport à la semaine précédente. Cependant, les tendances relatives aux cas graves restent élevées. En moyenne, chaque jour, plus de 2500 personnes atteintes de la COVID-19 sont soignées dans nos hôpitaux, dont plus de 750 dans les unités de soins intensifs, et 40 décès sont signalés. Les cas de COVID-19 et des hospitalisations surviennent principalement chez les personnes non vaccinées. De la fin août à la fin septembre, le taux hebdomadaire moyen de nouveaux cas de COVID-19 était 8 fois plus élevé. Le taux hebdomadaire moyen d'hospitalisation était 26 fois plus élevé chez les personnes non vaccinées et chez les personnes entièrement vaccinées. L'Action de grâce étant passée, cela signifie que nous entrons dans la saison de l'influenza ou grippe. Si la grippe a été pratiquement inexistante l'année dernière, en grande partie grâce aux mesures de santé publique mises en place pour réduire la propagation de la COVID-19, elle n'a pas disparu pour autant. Cette année, nous pourrions voir une recrudescence de la grippe en raison d'une baisse de l'immunité de la population attribuable à une circulation moindre de virus lors de la dernière saison grippale et de l'assouplissement de certaines mesures de santé publique restrictives à l'échelle communautaire, rendues possibles grâce à la couverture vaccinale élevée contre la COVID-19. Les comportements que nous avons adoptés pendant la pandémie de COVID-19 peuvent contribuer à nous garder, nous et nos communautés, en bonne santé cet automne et cet hiver. Par exemple, nous faire vacciner contre la grippe lorsqu'il est possible de le faire et continuer de prendre des mesures de protection individuelle de santé publique comme porter un masque, améliorer la ventilation intérieure, nous laver souvent les mains et rester à la maison si nous sommes malades. Les mesures de santé publique individuelles forment la base des bonnes pratiques de santé publique et contribuent à prévenir la propagation de la grippe, de la COVID-19 et d'autres maladies respiratoires. Il est plus important que jamais de se faire vacciner contre la grippe. Le vaccin aide à prévenir la grippe et les complications connexes, comme la pneumonie, et peut également contribuer à réduire la gravité des symptômes. Si une quatrième vague prolongée de COVID-19 était combinée à une recrudescence de la grippe, cela pourrait exercer des pressions encore plus fortes sur le système de santé. Si nous voulons mettre toutes les chances de notre côté pour nous protéger et protéger les autres, nous devons respecter les pratiques de santé publique visant à réduire le risque de COVID-19 et nous assurer que tous nos vaccins importants sont à jour. Merci. Thank you. Miigwech.
Thank you, Dr. Merci. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We'll be taking questions in both official languages. Donc, nous allons prendre vos questions. Nous vous demandons de vous limiter à une question et une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la période de questions. Opérateur, over to you.
Thank you. Merci. Please press *1 at this time if you have a question. Veuillez appuyer sur étoile maintenant pour poser une question. Our first question is from Marieke Walsh from the Globe and Mail. Please go ahead. À vous la parole.
Good morning, doctors. I'm wondering first about vaccine mandates for healthcare workers. We've seen them roll out across many provinces, and I'm wondering if you think they are warranted or if the risk of losing staff outweighs the potential harm of spreading COVID.
Thank you for that question. Of course, as you know, that these mandates are in the provincial jurisdiction, and they, of course, know their workforce the best. But healthcare workers are, because of their jobs, are committed to protecting and essentially treating and supporting people at very high risk. So it is important that they get vaccinated both for the protection of themselves and the people that they're looking after. It is very important, actually, to protect healthcare workers because the health system is so fragile at the moment. Everybody's exhausted. And if healthcare workers have to go into quarantine, for example, after exposure, the system just simply isn't going to be sustainable. So I think provinces are taking into account all of these matters as they are looking at their vaccine requirements. You would have to go to the provinces. I actually don't know to what degree the vaccine requirements have boosted vaccine coverage, for example, in that group. But I think as a healthcare worker, it's important, very important, at least from my perspective, to get vaccinated.
It's Dr. New. I just would add, maybe it's a personal reflection as well, that certainly as a physician, if you look at the Hippocratic Oath, one of the most fundamental things in there is that, with respect to your patients, is do no harm. And so as far as I'm concerned, if you're not vaccinated, you certainly risk the potential of doing harm to your patient, by possibly getting infected with COVID-19 and transmitting it onto your patients, many who are, obviously a part of vulnerable populations. So I think to me, it's quite straightforward. If you're a healthcare worker, as part of your training and so on, and the vocation you've chosen, I think it's very important to be vaccinated. Thank you.
Thank you. Follow up?
Thank you. I'm wondering also about what the vaccination mandates mean in terms of spread of the virus. So when we're looking at areas where they have a vaccination mandate where you need to be fully vaccinated to attend something in the arts sector or to attend a live sports event or to go to the restaurant, because everybody in the room would then be vaccinated, does that mean that we don't need to have physical distancing? Does that mean that full capacity is safe again?
Well, I think vaccine certainly adds a significant degree of protection, and that's part of the reason, I think, why these vaccine requirements have come into play. But I think at this juncture, I would advise people to layer on as many layers of measures still, just because, we're in a fairly critical stage in the pandemic at the moment. We're still in the pandemic phase. We're at the top of this fourth wave. You've got to take into account what COVID activities like in your community. I actually think that's one of the most critical things, is to look at that. Because if you have a massive gathering, even if you've been vaccinated, it is still prudent to wear a mask and take on those personal protective measures. Vaccines have been extremely effective against severe outcomes, and it's still maintained, that vaccine protection is still being maintained. What we do know with the Delta variant, very transmissible variant as well, is that vaccine effectiveness against infection or asymptomatic or mild infection is reduced. So the most prudent thing, if you can, is just to keep up with those measures. And it prevents influenza and other things as well. So that's what I would suggest if you're going to a mass gathering event. But the PVCs or the vaccine passports will add a significant layer of protection, but not complete.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Merci. Notre prochaine question est de Raymond Fillon de TVA.
Next question
Please
from
go ahead.
TVA.
À vous la parole.
Go ahead.
Merci. Bonjour. Pour continuer dans la même ligne, avoir 338 personnes dans une salle comme la Chambre des communes, par exemple, avec certaines personnes non vaccinées, est-ce que vous considérez que c'est sécuritaire?
Do you think,
ou
in
le
your opinion, is
déconseillez?
this safe, or do you think it's ill-advised?
C'est Dr. New. Merci pour la question.
This is Dr.
Moi, je
New.
pense
Thank you for the
le
question.
principe, ça reste toujours, si on parle de la perspective de la santé publique, on va augmenter la couverture vaccinale le plus haut possible, et parce que ça donne un bon niveau de protection, mais à part de ça, comme Dr. Tam et moi, on a déjà constaté à plusieurs reprises, ce n'est pas le seul moyen. Les vaccins sont efficaces, mais pas 100%. Donc, je pense que c'est très important aussi avoir les autres mesures de santé publique, si c'est possible, la distanciation, le port de masque, tous les autres bonnes mesures déjà éprouvées. Donc, je pense que dans n'importe quelle situation, il faut mettre en vigueur toutes les mesures possibles pour protéger tous les participants dans un espace clos, n'importe où.
J'aimerais aussi vous entendre au sujet des tests de PCR pour entrer au Canada. Les Américains vont rouvrir la frontière, leur côté de la frontière le 28 novembre, n'exigeront pas que les Canadiens aient un test négatif. Est-ce que c'est encore nécessaire d'avoir,
and they do not require Canadians to have a negative test. In your opinion, is it still necessary to have a negative PCR test to enter Canada, or would you recommend that measure be lifted?
Okay, merci pour la question.
Answer. Thank you for the question once again. This is a current issue. We are continuing, as always, to analyze and monitor the evidence and the data in order to provide our recommendations from a public health perspective to decision makers. What I can tell you
de dépistage qui est en place actuellement,
on voit même
que parmi les voyageurs vaccinés,
vaccinated travelers,
parce qu'on exige, comme dit, les tests PCR avant.
Demanding the PCR test before they enter the country. I believe the positivity rate is 0.2%. So we can say, well, is that important? Is that major? It's less than 1%. But if the number of travelers increases,
comme si on parle des chiffres,
we could be talking
des nombres de personnes, ça peut être un nombre plus grand avec une augmentation du volume des voyageurs qui rentrent au Canada. Ça, c'est sûrement une considération. Un autre aspect ici au Canada, c'est qu'on est en train de gérer une quatrième vague et on voit que dans plusieurs provinces, ils sont vraiment dans une situation avec beaucoup de pression sur leur système de soins de santé. Donc, je pense pour le moment, il faut continuer à suivre les données probantes, mais pour le moment, on garde le système parce que même avec le dépistage PCR, on continue à trouver un certain pourcentage des voyageurs qui rentrent au Canada entièrement vaccinés et encore positifs pour la COVID-19.
COVID-19 tests.
Opérateur, prochaine question.
Thank you, Dr. New. Operator, next question, please.
Merci. La prochaine question. Our next question is from Annie Bergeron-Oliver from CTV National News. Please go ahead. À vous la parole.
Hi, thank you for taking my question. I'm just going to follow up on Raymond's question. Hopefully you can answer in English. So business groups are urging Canada to scrap the PCR requirements for returning travelers who are vaccinated. I'm just wondering what type of benefit does this PCR test provide and should it be kept?
Thank you very much. I'm trying to remember what I said in French, but essentially, certainly, it's a live issue right now. As always, we continue to look at the scientific evidence and the results of our current testing regime at the border, which does include the sort of the requirement for that PCR test, a negative PCR test, within 72 hours prior to coming to Canada. And what I think is interesting is that based on the data that we've been able to analyze to date, there's a certain percentage, about 0.2%, I think last time I looked at the data, of fully vaccinated travelers coming to Canada that have tested positive for COVID-19. So then the question, ensues, okay, is that, good or bad? It's less than 1%. But if you look at the volumes of people increasing coming to Canada as a percentage, the actual true number of people coming would obviously potentially be increasing as well. So I think that right now it's certainly another layer of protection. It's something that is in place at the moment, and we continue to look at the evidence. But as we've said before, that there's no sort of a system that's foolproof, and I think at the end of the day, it's a matter of sort of looking at from a risk perspective, risk tolerance and risk management. And obviously, we give our best advice to the cabinet and the government.
And maybe I'll just add that we have to have ongoing evaluation and discussions. There is no doubt. But I would just like to remind everyone that right now we're still at the top of that fourth wave. We're in a situation in Canada where our health systems are still very fragile. We need to take a precautionary approach in the next little while, and we'll continue to evaluate the situation. Some of our key, most important things we're trying to achieve are keeping kids at school, keeping people at work, and by keeping the levels of COVID-19 low, as our vaccination, which is incredible, by the way, the vaccination coverage is still going up. We're studying the need for boosters, and all of those things are actually at play at this moment in time. So in many ways, we need to still be very vigilant and careful at this point. But we will have ongoing discussions with the CDC and the United States to see what is reasonable in the trajectory going forwards.
Thank you very much for that. The FDA advisory panel has cleared the path for booster shots for Moderna for people 64 and over. I'm wondering when you foresee this happening in Canada as well, especially in long-term care facilities. So when do you foresee booster shots being approved for people over 64?
There's two aspects to this question, I think. Health Canada has got the submissions from Pfizer and from Moderna for the additional dose, and they're reviewing that as fast as they can. And I think they are expecting it fairly soon. But I think we'll have to go back to them to ask about that. At the same time, and we're trying to coordinate this, the National Advisory Committee on Immunization is going to be making further recommendations quite soon, actually. We expect that on additional doses. Just as a reminder, NACI's already made a recommendation to give an additional dose to people who have lower immune responses, those who are immunocompromised, and they've already recommended vaccination, an additional dose to those in long-term care, senior and congregate living settings. So provinces are already beginning those boosters. And we expect the National Advisory Committee to next make some recommendations on other high-risk groups, and some of whom receive the vaccines the earliest in our vaccination programs. And we expect that to occur shortly.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Notre prochaine question est de Catherine Lévesque de la presse
Next
canadienne.
question,
À vous la
Canadian
parole.
Press.
Please go ahead.
Please go ahead.
Oui, bonjour à vous deux.
Yes, hello
Dr. New,
to
je
both
voulais
of you.
juste vous
Dr.
poser une autre question
I
sur la
have another
vaccination
question
des
for you about
députés au
vaccination
Parlement
of MPs in
et
Parliament,
surtout sur la distanciation sociale.
especially when it comes to
Il faut
social
quand même
distancing.
garder des mesures.
Certainly, measures must be kept up. Has the government consulted you when it comes to the return of Parliament and the fact that there will be 338 MPs in one chamber without special ventilation?
Merci pour la question. Moi, je peux dire qu'on a déjà donné nos conseils, recommandations.
I think we already have provided our advice and recommendations when it comes from public health perspective for all workplaces, and we can consider the House of Commons as a workplace as well. Personally, I have not received a request for further recommendations that are specific to the House of Commons. I can't speak for Dr. Tam. She herself may have had other conversations.
C'est une question peut-être posée
But this may be a question
si vous
to ask the Prime
poser une
Minister.
question selon la politique pour les députés.
If you want to know what the policy will be for
quelque chose à ajouter.
Perhaps Dr. Tam has something else to add?
I don't know if Dr. Tam wants to answer.
Donc, comme Dr. New a déjà dit, on a donné des
as Dr. New has already said, we have provided advice as to the importance of vaccination,
et aussi les autres mesures,
as well as other public health measures
de prévention.
and preventive measures.
C'est la même politique.
So the same policy applies
de mettre en place pour la Chambre de communes ou les autres
to the House of Commons
committees de Parlement.
Any other or any other parliamentary
and
committee.
Of course, for the federal government and our employees, we already have policies that's being rolled out as we speak on the need for all federal employees to be vaccinated, save for very little exemptions in terms of rationale. So we're, of course, as federal employees, public service, very supportive of this approach.
Merci, Dr. Tam. Suivi?
Oui, merci. Donc, si je comprends bien,
follow-up question? Yes, if I correctly understand, then the
l'Agence de la santé publique à ce
government or the Prime Minister has not consulted the Public Health Agency on this topic. And Dr. New, I wanted to ask you, should the MPs, in fact, number 338 in the House of Commons in person, must they all be fully vaccinated? Do you think this is a plausible recommendation in the according to the Public Health Agency?
Merci pour la question. Moi, je peux dire que dans tous les milieux de travail, et Dr. Tam et moi aussi ont déjà parlé de domaine de politique pour les fonctionnaires. Je pense que c'est important comme principe d'augmenter idéalement 100% d'une population ciblée soit vaccinée. Donc, c'est ça pour, comme un objectif de la santé publique, mais si on parle des personnes spécifiquement, c'est quelque chose peut-être mieux posé comme une question pour le Premier ministre, mais nous autres, on a déjà donné nos recommandations. Je pense que c'est toujours idéal, moi, pour tous les travailleurs de soins de santé, il y a beaucoup de groupes on continue à recommander les vaccins, c'est très important. On voit que c'est efficace, que pour moi, s'il n'y a pas vraiment, comme on dit, une contre-indication médicale, parce qu'on a eu déjà peut-être une réaction anaphylactique contre un vaccin ou peut-être un myocarditis après une première dose d'un vaccin. Moi, je vois aucune raison pourquoi pas se protéger contre une maladie si grave comme la COVID-19. Et ce n'est pas seulement une question de se protéger, mais aussi protéger les autres. Dr. Tam et moi, comme beaucoup des Canadiens, nous sommes entièrement vaccinés. Je pense que c'est quelque chose qu'on continue à encourager tous les autres Canadiens et Canadiens aussi à se faire vacciner s'ils n'ont pas encore reçu les deux doses pour la vaccination complète. Merci.
Doses of the vaccine.
Merci, Dr. New.
Thank you, Dr. New.
Prochaine question.
Thank you. Our next question is from David Turton from CBC News. Please go ahead. À vous la parole.
Hi, doctors. Pfizer has been clear that it is seeking approval for its new pediatric formula. It does not want Canada vaccinators to draw lower doses for kids from vials already shipped or on hand. Even if this isn't the usage that the company has approved or wants, could Canadian regulatory authorities recommend maybe an off-label usage to take advantage of our existing inventory of Pfizer vaccines? Or will kids in this country have to wait until the federal government is able to procure shipments of the pediatric version of the Pfizer vaccine, however long that takes?
Yeah, so Health Canada has not yet received submission for the vaccine for kids under 12, but there's been rolling submission of the data. And so it's by looking at the data that we can essentially Health Canada will confirm what the dosage would be. So I think that drawing up pediatric doses from the existing vials is not something that is recommended at this point for a number of reasons. We also understand from Pfizer that there's the formulation has shifted. So this is their sort of next generation formulation. And so that is something that needs to be examined by the regulator. So at the same time, I believe Minister Anand had commented on this, that we are already, of course, in communication with Pfizer about the supply of pediatric doses. And we're trying to get all of those things lined up and expect some communications on these fronts in the weeks to come. At the same time, there are other ways to protect kids, as we all know. And I'm actually very happy to hear that, given how many weeks we've had kids in school now, and of course there's been cases and there's been some reports of outbreaks in general, people have been able to keep kids in-person learning. And the most important thing right now is the adults and the older siblings around them should get vaccinated to afford them some protection, because the most high-risk transmission setting for kids under 12 are within their families. So that is something that people can do right now.
Thank you. Follow-up?
Yeah, I'm wondering if you could maybe expand on your comments, Dr. Tam, that this is a next generation formula. What exactly, kind of just maybe break that down for us? Is it to deal with, the way that this virus has evolved? Does it provide better protection against the variants of concern? And I don't know this, but I'm just going to ask it. Do we typically do vaccines when it comes to vaccines for younger populations, younger kids? Are they typically different? Is it out of the ordinary to maybe take an adult vaccine and use it on kids just in a lower formulation? Is that out of the norm? Does that happen sometimes? So if you could just maybe expand on the next generation comment and is it out of the norm for us to use maybe adult vaccines in lower dosages on young people if it's safe?
Well, I think just to clarify, that is not a different sort of variant or different formulation from the virus, from the mRNA component. It's more the other elements in the vial. And certainly we can provide further information from Health Canada as they're examining the composition of the vaccine. But it's really just tweaking and improvements on the formulation by the manufacturer. But at the same time, of course, for example, and one thing we have to consider is with the amount of vaccine that has to be drawn up, which could be quite different in children with a lower dosage, for example, that it might not be very easy to draw up vaccines. You can certainly look for different kind of needles that might do the trick, but you can't just dilute that vial by increasing proportions, because that might actually change some aspect of how the formulation might work. So that's why it's very difficult. And then there are some other considerations, of course, in terms of multiple, plunging into a vial of different needles can increase certain risks of, inputting microorganisms, but that's I think a sub bullet of considerations. But I do think that we should follow the data. We need to examine the data for safety and effectiveness and let the regulator do its work and the National Advisory Committee on Immunization to do the recommendations prior to implementing a general immunization program for children.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Notre prochaine question est de Éric Plouffe de Radio-Canada.
Next question, Radio-Canada. Please go ahead.
Bonjour à vous deux. J'aimerais revenir sur la question de l'exigence de tests de dépistage à la frontière. J'aimerais des précisions. Est-ce que c'est possible de savoir, parce que le taux de voyageurs positifs est quand même très bas, est-ce qu'il y a un seuil de taux de voyageurs positifs en deçà duquel les tests ne seraient plus exigés?
Under which tests would no longer be required?
Merci pour la question. C'est Dr. New.
Thank you for the question. This is Dr. New. The short answer is no. There is no such threshold. It's really about continuing to analyze the data. And also about the threshold for tolerance for risk, because we're continuing to have good conversations with our provincial and territorial counterparts. And we can tell you that there may be an array of perspectives when it comes to the tolerance for risk amongst provinces and territories. So it's very important to continue to collaborate with provinces and territories. And as I answered previously, I believe in French, and Dr. Tam said, repeated it in English, besides the border, we also have to look at what the situation is here within Canada. And we can see that several provinces are still feeling tremendous pressure on their healthcare systems. So we must continue to manage what it is we're doing to protect the Canadian population within our own borders. If we continue to see more fully vaccinated travelers entering Canada,
c'est quoi les couches de protection?
Then the question is, what level of protection do we require to ensure
bien protégés contre la COVID-19 et aussi c'est quoi le risque aussi peut-être de transmettre le virus aux Canadiens parce qu'on voit aussi avec le vaccin, avec aussi le variant préoccupant Delta, que c'est aussi possible pour même une personne entièrement vaccinée d'être aussi contaminée avec le virus. C'est aussi c'est possible de transmettre le risque et la probabilité est moins.
Of course, the risk is lower compared to an unvaccinated person, but it is not zero risk.
C'est nécessaire d'analyser et c'est pas seulement un simple chiffre comme c'est quoi le taux de positivité parmi les voyageurs qui rentrent au Canada entièrement vaccinés.
Among fully vaccinated travelers, that is to say.
Mais pourquoi c'est pas possible dans ce cas-là? Parce que les tests de dépistage coûtent très cher pour les voyageurs. Pourquoi les tests rapides ne sont pas une possibilité?
Why are rapid tests not a possibility?
Merci pour la question. C'est une bonne question, mais c'est aussi un peu
That's
technique.
A good question, but it's a bit technical.
Je pense qu'on a répondu à cette question
à
plusieurs reprises aussi parce que les tests rapides, c'est sûr, c'est un autre outil, c'est un bon outil
do provide another tool, and it's good to have more tools in the arsenal of protective measures. But
comme sensibilité aussi spécificité pour
there is also the issue of sensitivity and specificity
des résultats fiables et
and
on sait que les résultats fiables si on parle des fausses positifs et fausses négatifs
we all know about false positives and false negatives that it can be a problem with rapid tests
efficace ce que je peux vous dire comparé au dépistage PCR donc c'est peut-être mieux utilisé dans certaines circonstances peut-être pour comme un programme de dépistage, si on fait un test dépistage pour quelqu'un peut-être 2-3 fois peut-être par semaine régulièrement, aussi peut-être si on a aussi une indication, on a une éclosion. Il y a certaines circonstances. C'est une réponse longue, mais c'est pour vous dire que chaque technologie, chaque dépistage a leur propre meilleure utilisation et le dépistage PCR pour l'instant, pour une seule dépistage pour un voyageur qui rentre au Canada, c'est plus fiable pour les résultats que seulement un test rapide.
Provides more reliable results than rapid tests. Thank you very much.
Merci, Dr. New.
Thank you, Dr. New.
Next question.
Merci. Our next question is from Laura Osman from the Canadian Press. Please go ahead. À vous la parole.
Good morning. Thanks for taking our questions today. I wanted to follow up on what you were saying about the flu. You mentioned that our healthcare systems are already quite fragile, and the latest surveillance data shows higher than expected levels of RSV. I'm just wondering what, if anything, can be done at a national level to bolster hospitals that are already getting slammed in the ER. I'm thinking of places like CHEO, who may need extra support when they've already been burned out by COVID.
Yes, so on the public health sector, of course, we're in the prevention business, and again, emphasizing that get the flu shot. The clinics are probably about to start. Every province and territory will make a decision on when they do that. So that's very important for anyone over the age of 6 months, because that would help reduce the pressures on the health system. And of course, using the great sort of personal protection behaviors that we've learned during COVID can help prevent the other viruses, including RSV. I think we've seen parainfluenza virus as well as influenza. And so all of these things can help reduce the pressures on the health system. Of course, healthcare capacity cannot be generated overnight, and particularly things like ICU capacity. We've continued to offer surge capacity to provinces, working with the Canadian Red Cross, working across other jurisdictions to get mutual aid. The Canadian forces have been supporting different areas, but this is not a highly sustainable situation. People need to do everything they can to reduce both COVID and other respiratory viruses in order to keep our health system going. Just to remind people, of course, that even before COVID, there's some very, very severe influenza seasons where you're already going to get the ERs crowded and your hospitals at overcapacity. So this is definitely not a year to have influenza, wreak havoc. So I think as much as possible, do all of those layers of protection. I don't know if there's any more that can be said. Pediatric hospitals are finite capacity.
Thank you, Dr. Tam.
Thanks for that. And I'm also wondering, you mentioned that we sort of have a lower immunity to flu viruses because we were so protected last year by public health measures. There are still public health measures in place this year. So are you expecting sort of a less severe flu season this year, or is that lack of immunity going to play a larger part? Are there any sort of forecasts for the flu season this year?
As in any flu season, we at this point in time, we always say it's too early to tell, and that would be the same for this season. But you're right in that. Where would that balance come in? One thing is that, of course, kids under 12 don't have the protection from COVID-19 vaccine. They're going back to school. Even though they're observing other measures, schools are putting in place certain measures, and there could be transmission. And the younger cohorts of individuals haven't really seen influenza, perhaps in particular the youngest children. So if flu circulates, it could impact them quite severely. So I think, I hope that, yes, there's some measures being relaxed for sure that could accelerate accelerate influenza spread. But we've learned a lot about infection prevention control, both as individuals and as institutions. Long-term care facilities must put in place, must not forget you need strong infection prevention control measures, even if you've had the COVID-19. Get the influenza vaccine for our elders and keep up with infection prevention control measures. That will have a impact on our disease trajectories. Even if other aspects of daily life has been eased, those measures should still be in place.
Yeah, it's Dr. New. Maybe I can just elaborate on a few points that Dr. Tam's already raised. So when we talk about public health measures, we can see that, as a society, we want to open up and get back to, quote, as normal as possible our lives from before. And so, with capacity limits increasing, let's say in sporting events and so on, that's, I think, sort of a positive step. But obviously that's based on, high vaccination rates and so on. But I think if there is a silver lining, as evidenced by what happened with the flu season last year, is that people have taken to heart the personal protective measures that you could be taking to protect yourself, not just against COVID-19, but against a whole host of respiratory infections. So look at, hand hygiene and the sanitizer, hand sanitizer you see available everywhere. And, and the use of masks as people go out in public, as well as obviously people staying home if they're sick. And so hopefully these types of behaviors will carry on long past, hopefully when we get past COVID-19 and become part of sort of normal health behaviors to protect ourselves in the future against other respiratory infections, including annual flu. Thank you.
Thank you, Operator. Question.
Thank you. Our next question is from Jamie Moracher from Global News. Please go ahead. À vous la parole.
Hi, all. My apologies if you answered this in French. I actually got kicked off the call for a little bit, but I will re-ask it in English. I'm just wondering if you have been in touch with your U.S. counterparts to get clarification on whether Canadians with mixed vaccines will be accepted as fully vaccinated travelers come November 8th. I am seeing some news outlets who say that the U.S. travel policy will consider people with mixed as fully vaccinated. Are you guys hearing anything?
Maybe I'll start just because I think that you're referring to a question answered in French. What I would say is that Dr. Tam, myself, and others, as we've said previously, it's been a sort of a full court press or no stone unturned in terms of our discussions with U.S. officials at all levels and all different departments with respect to showing them sort of the Canadian data and why we've done so well with our quote mixed dose schedule. Other than that, I think the U.S. Itself is conducting various types of trials with sort of mixed dose schedules, not necessarily the ones that we have real world experience, but other types. So I think they're open to the idea. We've given them the data, and I know that there are other discussions ongoing. So that's about the extent as far as being at least being fully sort of in the know in terms of where we're coming from in terms of what we would hopefully have them put forward as our final policy. But I'll turn over to Dr. Tam for any additional points. Obviously, I think she's maybe had even more conversations with the U.S. counterparts.
We've engaged every organization and at different levels, CDC, NIH, and of course the different areas of the Health and Human Services, the Surgeon General, and others to discuss the global and health Canadian experience. But I do know that there's data being submitted that are done by the NIH, for example, looking at this very question. So I know that the United States is actively reviewing that evidence. We haven't actually heard what the outcome is, but obviously they will come to some conclusion prior to the proof of vaccination requirements when I believe in November. So that's a really important milestone to monitor, but we'll continue to keep engaging our counterparts on this front. But there is more and more data that is available.
Just a follow-up, thank you so much. On the same kind of note, I know that in general you have said that boosters for immunocompromised or elderly is kind of the take that we are going for. But would you, at this point, consider prompting provinces to move forward with boosters for travelers who have mixed doses, given it's still unclear what the U.S. has decided?
Yes, so this is a difficult area, but I think we are going to do our best with not just the United States, but we've been engaging all the sun destinations, and it seems that most of them will accept mixed doses or they have no requirements at this point. The Europeans, the UK is already accepting Canada's mixed dose, and we know that over a dozen, at least 16, I think at the last count, European countries have their own combination schedules already. So there are some countries where there's more certainty in terms of that recognition. But the US is the key country. So I think we're going to have another look at the national approach once we see what the US decision is. And of course, we want to be able to support Canadian travelers and look at all different options. But as you say, the US is key. And we look forward to keep engaging them and seeing what the decision is.
Thank you, Doctor. Operator, next question.
Thank you. Our next question is from David Turchin from CBC News. Please go ahead. À vous la parole.
Hi, thanks for taking another one of my questions. I really appreciate this. So my question is about some comments that Bonnie Henry made last week, Dr. Tam. She mentioned that surplus Moderna doses from BC will be donated internationally. And so I'm just wondering what arrangements are being made with that company or others to permit that donation under Canada's contracts, which previously didn't seem to allow that allocation. So is there any more information you could provide about that?
Yes, so one really key principle in terms of our vaccine rollout is that we must minimize wastage in Canada, as well as support the international response. So with both of those principles in mind, we have worked really hard to go places where we have never gone before, which is to have the abilities to gather up the unused doses that are still under under tight controls in terms of quality control and environmental control. So this being the provincial vaccine depots or stockpiles, and the federal central doses of vaccine. Those can now be moved out and be donated to other countries. So we've, of course, has been donating AstraZeneca vaccine internationally since the last summer, and that has worked. And so it would be the same concept in looking at our Moderna doses as well.
Thank you, Dr. Tam. David, do you have a last follow-up before we wrap it up? Thanks.
Yeah, so can you just clarify, previously it was our understanding that our contracts with Moderna and Pfizer did not allow for us to donate these vaccines. So has there been a change there? Has there been some movement there? And also, can you provide us any, numbers of how many vaccines are part of our existing inventory that will now be eligible for donations or that provinces are returning? So can you just clarify that one thing about whether or not our contracts have changed, or maybe it's always been the case that we could donate surplus doses? And if you have any numbers of, what type of vaccines will be rolling out the door to other countries that need it?
Yes, so there's different mechanisms, of course, that we can support international vaccine programs, one being actual direct contribution to COVAX, whether through financial contributions or through vaccines that haven't arrived in Canada at this point. But for the vaccines already in Canada, all I know is that we have managed to put that in place. with considerable effort to look at the maintenance of the integrity of those doses, which has to be verified, of course, by Health Canada as well. I personally am not involved in the contracting clauses. We can get back to you on that, but I do know that things, of course, have been worked out to allow us to do that.
Thank you, Dr. Tam. That concludes today's press conference. La conférence de presse est maintenant terminée. Have a good day. Bonne journée.
Thank you. Merci. The conference